Hello, community leaders, citizens, and legislators. My name is Leah Fournier Rivera, and I come before you today to guide your attention to a climate-driven health problem, one that has been multiplying alarmingly within the past few decades and only promises to get worse unless the issue is expeditiously addressed. I'm talking, of course, about Lyme disease. From 2004 through 2016, over 640,000 vector-borne diseases, that is, diseases spread by flea, tick, or mosquito, were reported to the CDC. 77% of these cases involved ticks specifically, and of these instances, 82% involved a Lyme disease diagnosis. Rate of human infection by this pathogen has more than doubled since 2010 and more than quadrupled since 1990, with 95% of these reported cases occurring within 15 states specifically. Territories primarily concentrated within the upper Midwest and Northeast regions of the country. So let us first review exactly what Lyme disease is and the health implications of being affected by it. Lyme disease is a bacterial infection caused by Borrelia burgdorferi that is introduced via tick bite as the arthropod claims a blood meal. Typically, a tick has to feed within the first 36 hours of attachment, so when all other preventative measures have failed, outdoorsmen and women should stay vigilant in performing repetitive skin checks during this time frame especially. Now we'll cover preventative techniques in greater detail in a moment, but if given the opportunity to incubate, Lyme usually begins to manifest 3 to 30 days post-exposure, and symptoms can be generally ambiguous, starting out relatively localized. Headache, fever, fatigue, and muscle and joint pain or any combination of these symptoms can occur. If the characteristic erythema migrans or bullseye rash appears, as it tends to do in about 70 to 80% of cases, this will also occur in stage 1 Lyme, or within the first month of affliction. Stage 2 symptoms develop in the months to follow if left untreated, and this is where the rash begins to spread to previously unaffected tissues. Stage 2 can cause neck pain or stiffness, weakness or numbness in extremities, and, as the nervous system becomes involved, paralysis of facial muscles, including but not limited to blurred vision and blindness. Stage 3 symptoms, as you probably guessed, are mostly critical and can manifest several months to several years after contraction. Here is when arthritis becomes severe, neurological symptoms worsen, and the heart becomes involved, Lyme carditis, which can further cause chest pain, palpitations, shortness of breath, and fainting as the heart's internal electrical flow becomes disrupted. Thankfully, all stages are relatively resolvable with proper antibiotic treatment. But why wait until symptoms have manifested when we have several primary preventative techniques we can easily employ first? While it is true that individual preventative techniques, such as wearing long-sleeved, light-colored clothing, rubber boots, and various topical insecticides, have proven somewhat effective in mitigating disease risk, my belief is that the future of this nation's health prosperity actually lies in a differing preventative, now gaining more and more traction within the scientific community: vaccines. As the committee is likely already aware, such a vaccine did exist for a few years at the turn of the millennium. It was actually demonstrated to be up to 80% effective in preventing Lyme after completing the full 3-shot series. This was this was before being taken off the market due to unfounded safety concerns that were unfortunately typical of the time period. More recent studies, however, indicate that between 64 and 70% of individuals residing in endemic regions are now partial to having this method of protection made available once more to the public. Numerous experts are also now coming forward, hailing this intervention as the ultimate solution in the battle of vertebrate versus vector, and questioning why climbing incidence rates have not yet led to recurring production by pharmaceutical companies. I respectfully ask for this committee's assistance in firstly influencing drug companies to once more resume vaccine synthesis that can then be ideally incorporated into child and adolescent immunization schedules, perhaps even becoming a standardized offering at adult physicals, such as annual flu shots have become. Community wellness advocates should, in tandem, spearhead health insurance initiatives to ensure that this promising approach is not dismissed as being cost ineffective, when comparatively the average cost of secondary and tertiary prevention, or lessening the disease's comprehensive health impact, is about $2,000 per patient. Thank you so much for granting me this opportunity to speak with you, and please be well.